Welcome to 360 Smarter Care and Joe's healthcare journey. I will be speaking while you are reading. If you find IT distracting, turn down the volume. I won't be offended. Through his association, union, or employer, Joe has a personal healthcare concierge, a healthcare coach, a physician's assistant available to him 24/7 365. Engagement with each individual covered under a healthcare plan is the same but different. Everyone in the group will receive an announcement of the new benefit available to them, an artificial intelligence-based healthcare concierge along with an invitation to opt in and create their own personal digital healthcare record and the benefits of having one. Some will engage with their personal healthcare concierge immediately. Others will want to know more and wait for more information. Each individual will follow their own unique path to engagement defined by their interaction with our artificial intelligence-driven communication platform. There are many benefits to having your own healthcare concierge. Let's look at one now. In the event you end up in an emergency room, as a patient or with a loved one, how important it is to be able to provide the attending ER doctor with a complete and up-to-date medical record? What drugs are prescribed, what conditions they are for, who the physicians are, complete with prescription and contact details. At a time of crisis, all the information necessary for the attending to treat the patient is instantly available through your personal healthcare concierge. Your healthcare concierge is proactive. In some instances, Joe's vitals could be monitored and exchanged with his physician when they reach a clinically relevant zone. All the communications between Joe, his healthcare concierge, doctor, and caregiver are confidential, voluntary, and HIPAA compliant. A 1C is an example of proactive monitoring for a diabetics. Most diabetics monitor their A1C. When a virtual care coach, a virtual physician's assistant, is also watching, they can notify Joe's real physician when warranted by A1C levels. This digital transaction prompts human intervention, most likely a phone call from a physician's assistant or a nurse. This human intervention will result in a change of Joe's care plan to keep his diabetes under control. As a result, Joe avoids a negative health event. IT could be not feeling well, a bad day, or IT could be a trip to the emergency room. The critical point is Joe maintains a healthier life. Joe feels better. Joe lives a fuller, richer, healthier life. At the same time, Joe's healthcare cost is reduced. What could be a better result of the health concierge than a healthier Joe that spends less time receiving costly medical care and more time as a productive person living a better life? Currently, there are more than 40 different versions of chronic care support available. Each was designed to solve medically, mission-critical, clinical care issues. To be explicitly clear, these programs are designed to solve clinical care issues, to improve patient outcomes. They are not, and were not designed to save the healthcare plan money. It is serendipitous for all that when an insured population is healthier, they are less expensive to insure and to care for. The 360-quadrant solution is based on two cornerstone principles. The first is healthier people are happier, more productive, and cost less to insure. The second is outpatient healthcare cost must be controlled with no loss in quality of care. We deploy an easy-to-use and network outpatient care cost control program. We implement our AI-driven personal healthcare concierge. We support the desired behaviors with video education designed for each specific group. Last and certainly not least, we treat healthcare cost expense like every corporate budget item, measure and review KPIs monthly. Based on the KPIs, our granular actionable data, we adjust our initiatives on a monthly basis, with you as the plan sponsor and the key stakeholders for your group's healthcare plan. Thank you for your interest in 360 Smarter Care.